Okay, so today I'm going to discuss about the important landmarks and the diameters of the pelvis. Now, I will talk about the important landmarks. First landmark, that is sacral promontory. Then the next one is the ala of the sacrum. Then there is the third one, sacroiliac joint. Next is the iliopectineal line. Fourth one. Fifth one is the iliopectineal eminence. Sixth one is the superior ramus of the pubic bone. Seventh one is the pubic tubercle. Eighth one is the pubic crest. And ninth one is the upper border of the symphysis pubis. So these are the landmarks over here, and we can just go through the landmarks as this side also similarly. Now, what are the difference between a true pelvis and a false pelvis? False pelvis, it contains only the structure, that is the iliac crest and iliac fossa laterally. Anteriorly, it is supported by the anterior wall of the abdomen, posteriorly by the lumbar vertebra. So it cannot be measured, and it does not have any measurement, but it has a clinical significance to hold the uterus. And the next, so it is termed as false pelvis. But the next one is the true pelvis. What is it? True pelvis have three parts. One is the brim or the inlet. Next one is the cavity, and the third one is the outlet. So at first I'm going to discuss about the diameters of inlet of the pelvis. So inlet is having, as you can see, this is the inlet. This is the inlet or the brim. So this is having three diameters: anteroposterior, transverse, and oblique. First, I'm going to discuss about the anteroposterior diameter. Anteroposterior diameter again can be divided into three parts, that is true or anatomical conjugate, obstetrical conjugate, second one, and the third one is the diagonal conjugate. Now, the anteroposterior diameter is measured from the midpoint of the sacral promontory to the upper border of the symphysis pubis. This is termed as true or anatomical conjugate, which is of 11 centimeter in length. Next one is also measured from the midpoint of the sacrum promontory but to the inner border or the mid border of the symphysis pubis. It is termed as obstetrical conjugate, and it is having diameter of 10 centimeter. The next one is measured from the midpoint of the sacral promontory to the lower border of the symphysis pubis, and this is about 12 centimeter, and it is termed as diagonal conjugate. So this is all about the anatomic anteroposterior diameter of the inlet. Now the transverse diameter. Transverse diameter is the longest diameter of the inlet, and it is measured from the two iliopectineal line. So we can just show it like this. So it is about 13 centimeter. Now the oblique diameter is measured from the right sacroiliac joint and also the left sacroiliac joint. There are two oblique diameters. So the right oblique diameter is measured from the right sacroiliac joint to the left iliopectineal eminence, and we can measure the left oblique diameter from the left sacroiliac joint to the left iliopectineal eminence. This is about 12 centimeter in length, and these are all about the diameters of the inlet or the brim. Now I will talk about the diameter of the cavity. As you can see, the cavity is uneven, or it is just round in structure, but there are certain soft tissues and muscles which are getting attached. So we cannot just measure the diameter of the cavity, but we can roughly measure the anteroposterior measurement. That is, we can just go towards the third phenomena or two-third of the sacrum. From the two-third of the sacrum, we can just end it towards the mid inner border of the symphysis pubis, and the measurement is about 12 centimeters. So we can say that pelvic cavity is having a measurement of 12 centimeter from wherever we measure it. Now I will talk about the diameter of the outlet. There is two types of outlet, that is, one is obstetrical outlet, another one is anatomical outlet. The anteroposterior diameter of the obstetrical outlet is measured from the tip of the sacrum, to the lower border of the symphysis pubis, and there is about 11 centimeter. Next is the bispinous diameter, which is measured from two spines. It is about 10.5 centimeter. Now the anatomical outlet, which is measured from the tip of the coccyx towards the lower border, and it is measured about 13 centimeter. And there is bituberous diameter, is the transverse diameter, which is measured about 11 centimeter in length. And there is also the oblique diameter, that is measured from the obturator foramen towards the right obturator foramen towards the left sacrospinous ligament. So this is the oblique diameter, which can be said 12 centimeter. So this is about the diameters of the pelvis. So this is all about the video, and if you are having any queries, comment it down. Thank you so much.